Hello, and thank you for choosing Santa Monica Center for Oral Surgery and Dental Implants.
We're here to make your healing process quick and easy.
Some common dental implant post-operative conditions may include
difficulty opening the mouth due to muscle tightness and swelling, discoloration or bruising of the skin,
numbness around the corners of the mouth, lip, or chin,
sore throat with difficulty swallowing,
slight earache or aching in other teeth, dryness or chapping of the corners of the mouth, which may be treated with lip balms such as Vaseline or Neosporin ointment.
a slight temperature elevation up to 1.5 degrees above normal for a few days. Nausea may be related to pain medication or swallowing blood.
Discontinuing the prescription medication or reducing the amount to take 1/2 the fourth tablet may help.
Small fragments of bone may occasionally loosen and become exposed through the gum. These usually work out on their own, but if concerned, return to the office for evaluation.
If you have any questions, please do not hesitate to contact our office to speak with one of our assistants or your doctor directly. There is a doctor on call 24 hours a day, 7 days a week.
If you are instructed to wear your removable appliance, full or partial dentures, plates, false teeth, flippers, it is important that you keep your appliance in your mouth continuously for 72 hours to keep the swelling under control. Even leaving it out for the 30 minutes during the first 3 days may result in enough swelling to prevent comfortable fitting of the appliance. You may remove it briefly during the first 3 days to clean it under running water.
Swelling after surgery is expected and usually increasing slowly, reaching its peak in about 48 hours. To minimize swelling, pain and discomfort, apply cold ice packs over the area of surgery. Icing the surgical area should be alternating between 20 minutes off and 20 minutes on.
In addition, take 600 milligrams of ibuprofen, 3 Advil tablets, or 3 Motrin tablets available over the counter every 6 hours for the first 2 to 3 days following the surgery. Do not take ibuprofen if you're allergic to aspirin or Aleve, or instructed by your physician. You may still take the prescribed pain medication as directed, in addition to over-the-counter pain medication, if the pain is still severe. Aspirin is not recommended for pain due to its blood-thinning effects. If you're unable to take ibuprofen, you may substitute with 2 extra-strength Tylenol every 6 hours. Tylenol should not be combined with Percocet, Vicodin, or Norco to prevent potential liver damage.
It is not unusual to have minor persistent or spotting bleeding for up to 48 hours following the implant surgery. Avoid excessive rinsing of the mouth and bite firmly on a gauze sponge placed directly over the surgical site for 15 minutes, repeating as necessary.
A caffeinated tea bag moistened in warm water may be used in the same manner should the oozing continue.
You may gently brush your teeth the following morning after surgery. Avoid using an electrical toothbrush on the site until the permanent crown is placed by your dentist, as the vibration of the toothbrush may loosen the implant healing abutment. Rinse your mouth with warm salt water 3 to 4 times a day for the first week to keep the surgical area clean. Flossing should be avoided around the surgical area for the first 2 weeks after surgery.
Smoking will significantly reduce the success rate of the implant. It can compromise the aesthetics of your final crown and accelerate gum recession, resulting in parts of the metal being visible in the mouth. It can also prolong or worsen the post-operative discomfort. Absolute abstinence is recommended for at least 2 weeks following the surgery, if not indefinitely.
Diet and exercise. As long as you are careful to keep the food away from the surgical site, there is no dietary restriction. You may eat after surgery as soon as the numbness wears off. Do not chew any food in the surgical site for at least 2 weeks until the gums are healed around the implants. However, if you have a temporary tooth placed, avoid chewing on it until a permanent crown is placed by your dentist. Usually takes 4 to 6 months.
To minimize inflammation around the surgical site, avoid strenuous activity for the first 3 to 5 days following the surgery.
If a temporary tooth has been placed over your implant, your night guard must be adjusted by your surgeon before wearing it.